for joining us today for our Healthy Town application webinar, which for those of you who have joined us in the past know it's more of a technical assistance. So please continue to type questions into the chat or the Q&A. We will do all questions at the end, but if you're thinking of them along the way, don't hesitate to type those in. I'm Julie DeSimone. I'm the Director of Community Health here at the Quality Institute, and I run our Mayor's Wellness campaign. And then I also have Katie Basaha, who is helping out today. Most of you know her. She is my colleague, and we both work in our community health program. Just before we get started, I just want to thank our 2023-2024 Crystal and Platinum sponsors for their support. Without their partnership, the program would not be possible, and specifically for our Healthy Town initiative, they really support our ability to recognize all of your great work. Just in case you're new to the program, I just want to do a quick overview. The Mayor's Wellness Campaign, like I said, is our statewide community health initiative. We partnered to do this program with the New Jersey State League of Municipalities. We provide mayors and community leaders tools and strategies to champion healthy and active living and to improve the overall health of your communities. The Mayor's Wellness Campaign gives mayors and your staff and volunteers the platform and tools needed to make your communities a healthier place to live, work, and play. So what is the benefit of becoming a healthy town? I'm hoping that many of you on today have already applied or perhaps are designated, but I'm also excited when there are new people who are interested in getting this designation. So just a couple of reasons why this is a great opportunity for your community. It's just a great chance to recognize all of the work that you're doing. It recognizes communities in which mayors have made healthy lifestyles a top priority, and that you're actively engaging all members of your community through inclusive, evidence-based health and wellness programming, policies, and a culture of health. And Healthy Town designations are a really great honor, and they're achieved, as you know, through a competitive process annually. So those three designations are a great way to challenge your Mayor's Wellness Campaign team to maintain or improve upon your designation from last year and to strengthen your programs, to utilize the designation to engage residents in the success of your program. So by being able to show your residents that you've achieved this designation, it helps you to be able to draw in more volunteers, to encourage local businesses to participate. So it's just a nice way to really get the word out about the program. And it also just gives you a chance to thank all of the staff, volunteers, employees who are working on your programs. So these designations are not given to a set number of towns, but rather the towns who apply and meet the high standards defined each year in our Healthy Town rubric will receive those designations. So Mayor's Wellness Campaign towns can be recognized in three categories: Healthy Town, which is our gold designation; Healthy Town to Watch, which is silver; and then Healthy Town Up and Coming, which is our bronze designation. So just to give you a brief overview of kind of the categories of each three of these levels. So in Healthy Towns, again, which is our top designation, these communities have well-established, engaged Mayor's Wellness Campaign committees that use research and local data, including social determinants of health, to assess the health of your community. They collaborate with local partners to implement programming to reach health goals established for the year, successfully evaluate programming, and have sustainability plans in place. So just kind of like the key takeaways from that is really using data to drive programs, making sure that you're picking programs that reflect that data, and then being able to evaluate programming effectively, which is really important. And we'll talk a little bit more about that later. For the Healthy Town to Watch communities, these are on their way to becoming a healthy town, and you've made a commitment to improving the health and wellness of your community. Along with key stakeholders, they have started to incorporate local data into programming and have identified ways to evaluate their programs. So again, you know, thinking about that data piece, maybe doing some level of data collection, using a broad range of programming to address needs, and making sure that you have really good community partners on board. And then for bronze designation, the Healthy Town Up and Coming, these communities have made the decision to focus on health and wellness in your community. You've started inviting important stakeholders to the table and offer healthy activities and education programming to your residents. So not as focused on the data piece, although we still want to see that in every program. And similarly, just making sure that you're really creating a collaborative program with your community partners. So now we're just going to walk through the application. And I will kind of give you an overview. There are very minor changes from this year. So we'll talk through those and then just kind of let you know what we're looking for in each of these questions. Let's see if I am smart enough to figure this out. Give me 1 second. Okay. So the Healthy Town application is due this year, January 19th at 5 p.m., or I should say next year rather. They must be received by 5 p.m. and the winners are going to be announced in March. And so when starting your application, we really just require some basic information to properly assess your municipality, such as your population, area, size. We also ask for contact information. I know that this sounds silly. Please be sure to provide the names and phone numbers of the people that you want to be notified if your award or if there's an issue with your application. We do ask for the mayor's information. It really is helpful if we get that correct information. I know sometimes people will put their own email if they're not the mayor applying, or a clerk email. As long as you feel confident that that information is going to get to your mayor, then that's fine. But it does help to have 2 different contacts for us so that we can notify you if there is an issue with the application. We are also asking you, again, just basic information about municipal address. Obviously, that should be easy to do. We're asking you for your latest date for your Mayor's Wellness Campaign participation pledge. If you don't have that information, you can reach out to us, but I encourage you to keep those records. When you sign the pledge each year, we do send them out to you so that you have that on file. It helps you with your sustainable jersey programming and other areas where you might want to show that you're part of the program. So I do encourage you to keep track of that. We are asking for social media information so that we can tag you if you receive an award. So just be sure to provide the correct information there. And if your community doesn't use those platforms, just indicate NA because that tells us that we don't need to go searching for you if you do win. In question 1, we're looking for really demonstrable research that you completed to determine your community's health needs and how your programming addresses those needs. We're looking for evidence-based programming that supports your research. So for example, if you reviewed your local community health needs assessment and discovered that your community has a high rate of residents with diabetes, then we would want to look for programming that addresses diabetes, such as chronic disease management and classes, opportunities for physical activity, or access to affordable healthy foods and education on healthy eating. So this is really the chance for you to understand where you need to be focusing your program. And we're just looking for you to demonstrate, did you look at any data to show what your needs are? If you didn't, you can put NA. It's very clear when folks have not done this, and it isn't going to necessarily make or break your entire application. It is something that we really want you to be focusing on. But if you didn't do it throughout the year, it's too late to do it now. So we just encourage you to provide just all of your correct information here and let us know how you're choosing the programs that you're choosing. In the second question, we are asking you for the top 3 areas of health and wellness that are of greatest concern to your community and letting us know how you identified those areas of health and wellness. So again, if you didn't do research, it's going to be challenging to answer this question. But we want to know, what are the areas that you think your residents are struggling with? And part of the reason why we ask that is because later on in the application, we want to know, did you address those areas of health and wellness with your program activities? So like I said before, if we know that your top need are high rates of diabetes, then when we get to your programming, we would hope that you're listing some programs that would help to address those needs. Okay, in question 3, we want to know who is on your Mayor's Wellness Campaign Committee, how they collaborate to create town programming, and include whether any residents serve on your committee and how often your committee meets. Again, if you don't have a committee, type NA. Don't tell me about your town council meetings that you have every week or your board of health meetings, unless you use those as your Mayor's Wellness Campaign Committee, which some towns do. But we really want to know, how are you coming together on a regular basis that you determine is appropriate for your community to really discuss your Mayor's Wellness Campaign programming? The Question 4 is new. It is asking if your committee has a diverse representation that reflects the demographics of your community. And we want you to describe that. And again, if it doesn't, you can put NA, and what we would hope is that by answering that question, you know that next year that might be something that you want to focus on. We really want to encourage towns to be inviting diverse stakeholders who are going to represent the unique needs of their most vulnerable populations and just the people that live in your community. And so by asking this question, we hope that you are doing this already. And if not, we hope that it'll encourage you to think about that as a goal for 2024. In question 5, you may remember this from last year. These are new, this is a new way that we did this, where we are asking you to describe your programs in a spreadsheet. So you're going to download the spreadsheet just like I'm doing here. You'll be able to enable editing, and then you're going to list up to 10. So no more than 10. We will not read past the 10 activities. We only want to see that snippet of, and you don't have to include 10, but up to 10. So you're going to tell me the name of the, the program and activity. What is the health goal of the program? So what are you trying to accomplish with this program? What needs are you trying to meet? The social determinants of health addressed. So back on this application, I will fix that. In changing the format, we didn't provide the information for, we have a link that will teach you a little bit more about social determinants of health if it's not something that you're particularly familiar with. So we'll get that back added to the application. But this is where you would figure out which social determinants of health is being affected by your program. Who is the target population for your program? For some of them, it's going to be the general population. But one of the things that in order to achieve these designations, one of the things that we're asking you to do is really think about underserved, overburdened, vulnerable populations in your community, and how are you addressing their specific needs? And so by showing us that you have a specified target population, you're showing us that you're really thinking about the needs of all of those unique residents. Partner organizations, one of the things that we're looking for here is, are you partnering with, if you don't have the expertise in-house, which many towns do not, depending on the topic, depending on the activity that you're doing, are you partnering with organizations that have that area of expertise? If you are presenting a education series on mental health, did you partner with a mental health organization or a mental health expert to do that? So those are just some of the things that we're looking for there. Cost to participate, we really do encourage you, again, through the lens of equity. We really want towns to be able to offer as many of these activities to, free or low cost as they can. So we're just trying to see if you're able to do that or not, because we understand that resources are a challenge. But that's why we're asking that there. The attendance that you had, and what was your evaluation method? If you did not evaluate your program, write that you didn't evaluate it. And then you're gonna, and I'll talk about this again later, but make sure that you're saving this document with your town's name in the file name. And then you're gonna upload that right to this area here. In question 7, you're going to be giving us an understanding of how you're incorporating our Quality Institute tools, resources, program ideas into your local mayor's wellness campaign. So, for example, if you did a walk with the mayor tool, or you pulled something from our mental health toolkit, be sure to note that. And if you use the suggestions in the Mayor's Wellness Campaign handbook to get your program started, or to collect data for your needs assessment, you can tell us about that here. Just trying to understand, are you utilizing our tools? Are they useful to you? And kind of which tools are the most frequently used that we put out. In question 7, we're asking you to describe how your Mayor's Wellness Campaign activities are funded. Again, as I mentioned earlier, it is helpful for us to really get an understanding of how towns are making this program happen. We know that some activities are built into the township services, like the libraries or recreation department. We know that some towns are fundraising, some are partnering with outside organizations, and that for some of your activities, you might be charging a fee. So this is just to help us get a sense of those different options for how to fund programming, and then to really understand, is funding a barrier to offering resources and activities that all residents can benefit from. This is a new question. So this is something that you will not be able to copy and paste from last year. So really wanting you to put some thought into this. And we also know that this may not have been a question that you were anticipating. So, that's okay. We just want to get a sense of where folks are at and then help you to build on that for next year. So in question 8, we're asking you to really consider, how does your programming address the specific needs of underserved residents in your community? And you'll see that we have this definition here. The term underserved refers to populations sharing a particular characteristic, as well as geographic communities that have been systematically denied a full opportunity to participate in aspects of economic, social, and civic life, as exemplified by the list in the preceding definition of equity. So every community is going to have underserved residents, and we just want to see if you've been able to really address their needs through your programming. And again, if not, we're here to provide technical assistance for you for this upcoming year to put a plan in place to do that. Question 9 is just looking for the number of people that participated. We know that sometimes we're not going to get an exact number, but it's just helpful to see the impact. As I mentioned earlier, something that really sets Healthy Town designees apart from our other Mayor's Wellness Campaign communities are the ability to evaluate programming. And so it's really important to know whether or not your programs are actually impacting your community. And so in question 11, we really want to hear about evaluation efforts. How have you decided that your programs are effective? If you haven't, you can put NA, because sometimes it can be clear that there wasn't an evaluation process in place prior to the program happening. But here you would list that taking attendance is one way. Obviously, it's important to get people out and to hear the information. Something that would be a little bit more compelling would be, did you do a pre or post survey? Did you ask for people's feedback? Did you do any kind of, if you're doing like a true educational program, did you evaluate the impact of the program and ask folks, what information they took away? So this is where you would describe that. And then in question 11, you're going to be telling us what feedback you received from those evaluations. So that's great that you completed the evaluation, but what did you learn and how did you use the feedback? So this is where you would really give the results of that and let us know if that was useful and meaningful in addressing the needs that you understood from those evaluations. And if you'd like to, you can attach surveys or evaluation tools here just so that we can take a look. So again, if you have those pre-post surveys or any follow-up tools that you use, we could take a look at those here. In question 13, we are looking for the future goals of your Mayor's Wellness Campaign and what areas of health and wellness do you plan to address in 2024. We're looking for specific goals here. If you know that, again, based on your evaluation process, based on that data collection process that you did, what do you think that your residents need and how are you planning to address those needs in the new year? In question 14, you're going to note any successful programs or initiatives that your Mayor's Wellness Campaign engaged in that you'd recommend. One of the things that we've heard from you, and you've probably heard me talking about it, is that towns are really interested in learning about what other communities are doing. And we want to help you to not reinvent the wheel and just share those really exciting activities that you're all participating in. And so one way to do that is to just share your information with us throughout the year, and we'll provide that in the newsletters that go out. But this is a good opportunity, especially from those of you who are applying for the Healthy Town designations, are kind of our best and our brightest, to really share what worked well, and can we share those opportunities with your peers across the state so that they can also participate in those activities. And then in question 15 is just an opportunity for us to get some feedback about what you'd like to see from us going forward. So are there specific tools, resources, speaker connections that you need? Are there different areas of health and wellness that you feel like we should be focusing on when we're creating these tools or providing education? Do you have any suggestions for us on how we can better support the work that you're doing? And then the last thing is optional, but it is always helpful if you can attach up to 5 additional documents that you feel would supplement your application. So oftentimes these are going to be photos. We love to see kind of the programs in action across the state of all the great work that you're doing. You can provide your flyers or any other, as people are becoming more sophisticated with their data collection process, we have had towns upload their community surveys or notes from their town hall meetings. So anything that you think is really just going to show us the effectiveness of your program. Okay. And again, we can go through questions at the end, but that's really the application. I hope that it's not overly complicated. We do try to make it as easy as possible to get the information. I just want to talk quickly about the rubric. I'm not going to read this to you, but again, as you've heard me say in the past, I really do use this as the tool to go through and score these applications. So I sit down with each application and I sit down with a copy of this rubric and I read through each section and each column and I give the score that makes sense based on the information that you've provided. So I really encourage you to sit down with this rubric, and if you want to be in this 2 column all the way through, you can really walk yourself through how to get there, because we do try to keep this very objective and concrete, and this will tell you exactly what we're looking for to get that highest number of points in each category. And the only other thing that I will note here is that if you did submit an application last year, you do get an extra 2 bonus points. Okay. Oh, I guess here, if this is helpful too, I can just talk about the scoring. So here's the scoring and what numbers you need to achieve to be able to get designated. So healthy towns, we're looking for the 33 to 42. Healthy town to watch is between a 23 and a 32. And then the bronze designation, healthy town up and coming, you'll get between a 13 and a 32. And then obviously if you score below that, you will not receive a designation for this year. And just again, as a reminder, this is really details how we as staff will be evaluating the applications. Okay, so just a couple of other things before we move on to the questions. Okay, so I just wanted to give you the list of towns that were designated last year in 2022. Hopefully your town is up here, and if not, hopefully that's why you're here today, to get up on the list for next year. It gives you a sense of maybe if you have a neighbor or someone a town that somebody well, they might be able to answer any questions that you have. And obviously I'm here to do that as well, but just gives you a good sense of kind of our distribution across the state. And I also just want to mention that this list has really grown in the last 5 years. I think the first year that I was here for this, we had 29 designees, and last year we had 38. So love to see more of you excited about this part of the program and really improving the quality of your program to be able to qualify for these designations. Okay, and so just some benefits that you'll have access to once you successfully receive your designation. All of the towns will receive a plaque and a banner, both of which you can see in these photos here. And this really helps you to share with your residents the accomplishments that you've achieved and to encourage a culture of health in your community. It really does make a difference when towns see these banners or hear that the designation was awarded, and they're really starting to pay attention to all of the programming that you're offering in your community. Each year we do publish a press release highlighting the winners, provide towns with like I said, with the outdoor banner and the plaque for your communities, and highlight you in our newsletter, on our social media, and in an article in the League of Municipalities magazine as well. So it really is a good opportunity to just get the word out about your town and have some good press around it. And so all of this not only helps you to give credit to your staff and volunteers, but also just really makes your community members more aware of the program, and then helps to increase engagement in all the activities that you're offering. Some important reminders. I cannot stress this enough. When you are working on your application, use a Word document as your draft. Do not work on the draft via our website. Our website is not It is just admittedly not the best platform for this type of like portal saving situation. And so I cannot promise you that that the website is actually going to save your information on the back end. And I do not recommend working on the document like that. Create a Word document, do all of your changes, and then when you're ready to submit, copy and paste into the portal. Note the character limits on the questions. It really does help you to understand how much information we're looking for. We chose those character limits purposefully, so it'll really give you a sense of, okay, they are really interested in this question and want to have as many details as possible, or let me just really basically answer the questions here and move on. As a reminder, we are only looking for information for your 2023 programming. This is an annual designation, and so you might have had the best program that you've ever run in 2022, and we're really excited that happened, but that is not relevant for this application this year. We are only looking at data collection, programming, and program evaluation that was done in 2023. Again, just as a reminder to include the town name in your uploaded files, specifically the program activities document in number 5, but also in all of your, in anything that you upload. It's really helpful if you name it so that I know what I'm looking at when I download the documents. Be sure to answer the questions. Again, I know this sounds like basic advice, but after reading these for a few years, I think it's just worth noting. We only need the information that we're asking you for, and the more concise and clear that your answers are, the easier it is for me to evaluate them. When you start kind of talking about things outside of the question, it makes it hard to follow, and it seems like you might not have the full answer to the real question that I'm asking. And so being clear, being concise helps me to really understand your program and what it is that you're achieving through it. As another reminder, application deadline is January 19th at 5 p.m. However, you do not have to wait until January 19th at 4:58 to submit your application. If you do, I really don't recommend waiting that long. The application went out in November. There's plenty of time to get it done. I can't promise you that there's not going to be a internet issue or a problem with our website at 4:58 on that Friday. And so once you have the application complete, submit it, and you do receive a confirmation that it was submitted. So if you do not receive that confirmation, please feel free to reach out to me and check in. Don't just assume that we have it, because I would hate for you to wait and find out that we never actually reviewed your application to start with. Okay, so I see in the chat and in our our Q&A box that we have some questions, so we can move over to that now. Okay, first question. Oh, I think hopefully I answered this. Are you able to work on the application, save and return, or do you have to finalize and submit it on session? Our website will technically have a button that says save, and we have had so many issues with this in the past. I do not recommend it. Do everything in a Word document and then copy and paste it is my very strong advice on that one. Okay, just gonna scroll back up and see where we are. Are we able to have access to the final score from last year's application? Yeah, Matt, you can, and anyone, you can always reach out to me for feedback on your application from last year. So just let me know if that's something that you need. I won't send out the rubrics, but I'm happy to talk through them with you. Is a copy of the PowerPoint available? First time looking to submit and considering. Sure. So this PowerPoint and a recording of this of the webinar will be posted to our website, and it'll go out in the newsletter on Thursday. If you are a first-time applicant and you have more detailed questions, please don't hesitate to reach out to me. I'm going to put my contact information up at the end of the PowerPoint, and I can kind of guide you if you have some more specific questions. That looks like all of the questions. Does anyone have anything else? Where can we find the rubric? Katie dropped a link in the chat, but it's also right on the website where you'll find the application as well on our Mayor's Wellness Campaign website. And I'm assuming Katie probably can drop that in too. Can I talk about how it links to Sustainable Jersey Action? So if you receive a Healthy Town designation, you are eligible for up to 25 points in the building healthier communities action in sustainable Jersey. Any other questions? Okay. Oh. Great. Yep. East Orange. I know we spoke at the League of Municipalities as well. If you don't, and I guess I should have mentioned this earlier. If you didn't have a program established in 2023, I still, I won't tell you that you can't apply, but it is challenging without having an established program to receive a designation. But I think that this webinar is a really great way to set yourself up for planning for a 2024 designation. But again, if you have more specific questions about your specific program, I'm happy to answer those offline. Any other questions? Okay, just have a couple more things I want to mention, and if people have questions, last minute questions, feel free to get them in. Okay. Just some upcoming activities that I would encourage you guys to be aware of and participate in. Sign the pledge, especially if you are planning to apply for a designation. You get more points if you have a current pledge. So again, pledge is annual, so is the designation. So have your mayor do that before the end of the year. There's still a couple weeks left to get that in. Statewide survey has gone out, and you will see it go out again. This is a little bit of a lengthier survey that we really are asking you to give us some information about your community, your mayor's wellness campaign makeup, and how we can better support your work. By doing both of those activities, you get 2 entries into our incentive drawing, which makes you eligible to win up to $1,000 for local programming. So they're pretty low-hanging fruit, and you might end up with some funding for your programs as well. So we encourage you to do that. And then we have mental health first aid trainings coming up. There's going to be 4 more of them in 2024. And so you'll see those flyers go out. The first one is January 25th. If you want more information right now about those, please, don't hesitate to contact me, but we will be sending information out about those. And it's a really great opportunity to educate yourselves, your police departments, your staff, your municipal staff, or your residents on how they can better support residents and individuals in need during a mental health crisis. Okay, I think a couple other, I'm just going to take a look at the chat really quickly. Yes, so just to be clear, designations do not carry every year, they're annual. So just because you received one last year does not mean that you do not need to apply this year. You need to apply again. Welcome, Upper Township. I know we've just kind of started getting in contact, and we're excited to have you here. You are able to apply even if you did not receive a designation last year. So no, you do not have to have received a designation last year in order to apply. Yes, Debbie, the mayor is technically the only person who signs the pledge. It is online, so if you are deputized to do so, that's for you guys to figure out, but we are looking for the mayor to kind of sign off on this, and then hopefully provide some contact information for another person in your network to be included as well. We do have a Word document of the application. We'll add that to the website to make it easier. We can do that. Good question, Deborah. Yep. Okay. Let's see. Okay. It looks like we covered all of the questions. Here is my contact information up on the screen. Hopefully you guys already know how to reach me, but if you have any questions along the way, or as you're going to complete your application, if you get stuck, don't hesitate to reach out. Again, January 19th at 5 p.m. We will not be reviewing any applications that come in after the fact, so please be sure to get those in. Thank you all for attending today, and I really look forward to reading all of your applications and learning about all the exciting work that you are doing in your communities.